Throwing a baseball is unnatural. And the reward system that's in the game today is even more unnatural and does not produce long-term care. Arm care has to be what's natural, what's max. If you're max effort, everything you're doing, and you're unnatural, you can just book it that there's no chance that that pitcher is going to stay healthy. No chance. And if those components are being driven into a young child and they're having to be forced to chase velocity at 8, 9, 10, 11, and 12, we are just producing, and again, this is the results goal-oriented of Major League Baseball. If the results and goal is to throw as hard as you can, what do you think young kids are going to do? They're going to train to do that.
Welcome to Feeling the Healing with Foltzy. We've got a roundtable discussion today with John Smoltz. Thanks for coming back, John. We got Keith Borger, who's a PT with Champion Physical Therapy. Keith works a lot with baseball players, so it's a great time to delve into some more information with John about just pitch mechanics, pitch count, what types of pitches should these kids be throwing at what age. So let's just get rolling, boys.
Yeah.
So, Keith, what's your first question you've got for John?
Just talk to me about kind of your philosophy of like what you've seen as you've developed through the years of what helped with your arm care and kind of injury prevention.
Yeah, this topic I could spend a week on. There's all kinds of studies done on what's right and what's not, and having gauges and barometers to try to kind of navigate the unknown. Because if every single pitching guru could watch every single pitcher pitch, you'd have an easy answer to when mechanically they're not sound and when they are not, when they are. So using a broad number, I just break down the philosophy. The reason pitch counts came into play, I forget how many years ago in the big leagues, was to teach a pitcher how to be more economical in their approach to getting hitters out. It wasn't based on this is the good number for you because once you go past this number, you increase injury or vice versa. That was never the purpose of pitch counts. So pitch counts have become an unofficial number because they had to quantify something, saying where do we draw the line, or at least treat each pitcher. They're not the same. Every body type's not the same. And this is what I would say. If I flick your leg right like this, I'm not hurting you right now, but let me do this for a week, or let me do this for 5 hours, I'm going to leave a bruise. And the philosophy of that is, if you have bad mechanics, it's like flicking the muscle or the tendon. And over time, you're increasing your chances for injury. So you can't just say 75 pitches for a 12-year-old is across the board normal, but it's a gauge. It's kind of like for parents that don't know any better or coaches that don't have it's a gauge to use. Throwing a baseball is unnatural. And the reward system that's in the game today is even more unnatural and does not produce long-term care. It produces injuries, surgeries, because we're throwing the ball too hard with too much force and too much bulk. So if you throw a ball naturally, this is what I would say, another theory I have. If you take away results and you just say a young man or professional, if I had to throw 150 fastballs in a baseball game with no connection to results, there will be less tension, there will be less stress, and therefore 150 should not have an issue throwing a ball 150 with no results oriented. But what complicates pitching is spin rate, high velocity, results, tension, getting in and out of problems, and getting in and out of jams. That's why the number means nothing in and of itself. If you don't have stress in a game, your number could go up. If you have good mechanics, your number could be above average. If you have bad mechanics, your number should go down. If you have runners on all the time getting out of jams. So do you see how many buckets you could fill up? Absolutely. And so for me, arm care has to be what's natural, what's max. If you're max effort, everything you're doing, and you're unnatural, you can just book it that there's no chance that that pitcher is going to stay healthy. No chance. And if those components are being driven into a young child and they're having to be forced to chase velocity at 8, 9, 10, 11, and 12, we are just producing. And again, this is the results goal-oriented of Major League Baseball. If the results and goal is to throw as hard as you can, what do you think young kids are going to do? They're going to train to do that. So it's like an open-ended answer that needs so many more components. To dumb it down, 15 pitches an inning is what theory says is going to be an advocate for most youth pitchers. Try not to throw breaking balls before before you start growing into your body, or you have different developments. And that's, they say when you start getting hair on your body, that's, maybe the time to throw breaking balls. But here's why people just have blanket answers. If you throw things properly, you can throw things correctly, right? So why people says don't throw curveballs, because they don't know how to teach it properly. I grew up in an era where throwing more often with less exertion was better for you than throwing max effort and reducing the throwing. So you throw more to get the stresses and use to your body and do it correctly off a mound. When you're trying to prepare for a season, you would do more things off the mound to create arm strength. But that's a long-winded answer to say whoever came up with the number did their best guess to try to give a gauge, but that number is not universal for every single child.
Let me, so there's a good chance that if it's a 14-year-old and he's got a mustache, a curveball might be coming.
Yeah, there's a chance that an 8-year-old's throwing a curveball, whether he has a mustache or not. Because if you give a child a tool to get another child out in baseball, what do you think he's going to do? He's going to use it every single chance he can. They're not dumb. And so we're breeding success too early. We're teaching dominance too early. And the reality is, it's like I used to tell all my parents of all the camps I did 13 years in a row, if this right arm or left arm is a gift, you don't want to wrap it up and never use it, but you don't want to unwrap it and abuse it. So there's a fine balance to what is the end game for a gift is use it as long as you can. And how do you do that? Well, taking care of it and not pitching on 3 teams and pitching all year and trying to get to a 0.5 ERA when you're 12. I hate to say it, big deal. The goal is, can we get to high school? Can we get to college? And then someday maybe to the big leagues. And so I've had parents tell me all the time, my son is 11-1 with a 1.12 ERA. I'm like, awesome. What college is he in? He's like, no, he's 7. I'm like, that's the emphasis that we're putting on that creates these stresses and these surgeries that are unneeded.
Absolutely. And you touched on it, like velocity is the name of the game nowadays. These young kids are looking up to their role models. And in the pros, everybody coming out of the pen is throwing 95 plus. And so velocity is king, but they're also seeing these crazy pitches like the splitters and sinkers, everything that is putting different stresses on the arm. For adults, they're trying to do when they're younger. Right. And they're not skeletally mature. They don't have the good pitching mechanics that you're talking about. So it's kind of a recipe for disaster. When you add on the component of year-round play where there's never a time to let the arm rest and develop better athleticism in other sports, it's setting people up for these injuries at earlier ages. Like the prevalence of Tommy John used to be really into the 20s. Now it's getting to 16, 15. 15-year-olds. And
it's sad because those are the myths that people just buy into. So-and-so had it, so we can have it, and he turned out fine. Here's the myth that people need to understand. If you have Tommy John, you have a great chance of coming back from that injury to the level you were at, not the level you're trying to go to. You're not going to be a big leaguer having Tommy John at 12 just because. You're going to be able to probably come back as a 12-year-old, and because of the technology and the rehab and all the information we have. But I'm telling you, if the shoulder was an accelerator and a brakes, like in a car, the gas and the brakes, too many times pitchers just kind of focus on one of those components. You have to have both working. Your shoulder's got to be able to slow down when you're max effort speed. There's so many things that people don't understand. You guys get to deal with it on a daily basis. But if you're out of balance mechanically, and you're out of balance structurally, meaning physically stronger than what you really need to be to throw a baseball, then you're putting your body at a disadvantage just to sacrifice to throw it as hard as you can. And I say this, I'll say it again, I say it every broadcast sometimes where I've talked about red line pitching. The tachometer on your car has the RPMs, and when it gets to red, it's a warning for your engine. But when you stay in the red, that warning becomes you're going to blow your engine. And that's what we're doing in pitching today. We're living in the red line. We're red line pitching. And it's like, no big deal. We'll blow and repair and go right back. It doesn't work that way. It's very few of the freakish guys that are able to have one, yet alone two, Tommy Johns, and be successful.
And one of the biggest myths is that you throw harder after Tommy John. You may, but there's so many side effects and negative components of a Tommy John surgery that is not worth taking on that risk.
Correct.
One of the things you touched on is like the pitch counts. And what I like to do is monitor an athlete with actual numbers, so dynamometry, testing their strength.
Mm-hmm.
I want to test them when they're fresh. I want to test them after, say, 25 or 15 pitches.
Right.
Then I want to test them after 50, 60, 70, so we can get an individualized number of when that athlete starts to fatigue to a point where injury may get concerned. Because one thing, velocity is key. Velocity is the name of the game nowadays. There's no arguing that. But if you're always trying to throw max effort, you only have so much opportunity to do that until mechanics change. And if your mechanics already are not great, then that's a concern. So without getting too much into the details, typically you're either going to be a major pusher off the mound, driving and creating power from the ground, or from rotation. What has been shown is if your legs are fatigued or if your arm starts getting fatigued, you're going to get increased velocity from rotation because you're trying to throw that max effort. If you're throwing 95 and all of a sudden you're dropping to 90, you're going to try to change what you have to do to get to 95. Well, then that puts the arm in different positions of vulnerability and leads you much more susceptible to injury. So if you can manage one, fatigue with your training program, and also the numbers of saying like, okay, at 50 pitches, you have a tremendous drop off. So that needs to be your pitch count versus somebody else who maybe is a little bit more of a finesse pitcher that doesn't have the velocity, but they know how to command the strike zone, change up the speeds. They may be able to throw 100 pitches and be substantially safer than the other individual.
You know what I would do to universally change, and it would undoubtedly affect injuries and increase the chances to be successful. You only have to do one thing, and you're going to think I'm crazy. Eliminate every technology that tells you how hard you throw.
I love that.
And if you did that, and we had the ability to watch use our eyes and see a child throw or a young man throw, it would be less computer input output that would be dictating the spin rate, the velocity, all these things, the metrics we're chasing. I believe that single-handedly has changed the game, and I know that the reward system is what it is, but here's what I would, if you have the luxury to be able to want to play 10 to 15 years, you can't max effort pitch. You just can't. Now, you'll get to the big leagues if you have a freakish arm and you could throw 98, 99, but it's a short life. It's 3 years, maybe 4, and I think we lose the numbers when you realize that the average Major League Baseball career, nobody's going to guess this. If you asked 100 people, they wouldn't get close. Do you know what the average Major League Baseball career is right now?
For pitchers or for
anybody?
2
Anybody.
years, 3 years?
Just under 3 years. Now, most people would say 10, 15 because you're going to see your stars play that long. Mm-hmm. But the shuffling that goes in and out and the inability to sustain, a career is because of the things we're talking about. And once I realized that I was beating this drum that had no sound on the other end, it's because they just plug and replace. If you get hurt, I'll get the next guy. And if that guy gets hurt, I'll get the next guy. So we're chasing a system that basically they would say has been created with youth baseball as the crack to the foundation. So the injuries are going to happen because youth baseball is embarked on this journey to max effort, swing as hard, and do all these things. And technology has taken us to that place. So for me, it's a shame because I was fortunate to play 21 years, 22 years of my career. I want to see the greatness play as long as they can. But this issue has kind of been thrown under the carpet with technology that we have the ability to now have Tommy John. We have the ability to repair a rotator cuff. We have the ability to do X, Y, Z. That doesn't mean you want them. And so how do we do our best to avoid it? And to avoid it, you've got to be balanced in all that you do. You cannot have a shoulder that's 2 times the size of your left shoulder. You can't have your right lat 2 times the size of your left lat. I mean, there's guys that had done it way before I have, for 30 years before me, and it's all been documented how successful they were. And now we have this severe decrease in innings and severe decrease in ability to play long. Why? We're smarter, we're bigger, we're faster, we have more technology, and we're going the other way.
Yeah.
And so when you talk like that, you know, people go, you don't know what you're talking about, Smoltz. You played in the Stone Ages. Get with the times. You got to throw 98, 99. So your point's well taken. Tommy John, when you end up having Tommy John, you have a decrease in your velocity that you don't even notice because you're compromising your ligaments, so that when you come back, you're actually throwing what you're capable of, but people say, nah, he's throwing harder. And it's a flaw, it's a myth. So don't buy into it.
Yeah. I love the idea of taking away the technology, at least the radar guns. Then suddenly coaches are going to have to go by the eye test of like who can actually command the strike zone, who is more deceptive with their pitches,
Remember,
who actually knows how to pitch versus just throwing.
You have to sacrifice something to get what you're trying to get. If you're trying to get max velocity, there is a less than 0.5% of the humans who can throw the ball where they want to with max velocity. So you don't have to teach the fundamentals when the technology and analytics is telling you power the strike zone. See that big box? Who cares where it goes in that box as long as it's around that box and it's max effort. Same thing in every other sport. Hit a golf ball 340. Who cares if you hit it in the fairway and you're 20 yards offline? You've just maximized your distance, and this is what works analytically. All these things that come out of a computer may work on paper. It has caused the physical attributes to decline and the injuries to go up. And, that's my opinion. I'm not a PhD, and I certainly don't have anything other than the experience that I've lived.
But you're right on point. Velocity is sexy. That's what people want to see. And so kids at young ages want to get there. The concern is, and this is proven science, every mile per hour of velocity increases your risk of injury by about 15%. So if you're 9 years old, 10 years old, 11 years old, trying to maximize your velocity versus learning the fundamentals of how to properly pitch or learn different pitches, then suddenly your risk is higher, and you're going to have these little micro tears at a younger, skeletally immature age. And guess what? That's just going to manifest more and more and more if you don't rest. If you're playing year round and you already have little micro traumas at 11, it can heal if you rest. But if you're doing year round sports, it's at 15 years old, you're setting yourself up for failure.
Here's the last thing I would say about it. Be careful of the big jumps in velocity.
Mm-hmm.
That is a precursor to the body can't handle. The stresses over the tendon for a young athlete is not prepared yet for that big jump in velocity. So let's just say your child's throwing at 80 miles an hour approaching high school, and you're like, oh no, I got to get him to 85 to 88. In 1 year, that's a bad thing. It's got to be natural. And anything unnatural is forced, and anything forced creates what you're talking about. Everything I did was natural. I never grunted when I threw a pitch. I never max effort a pitch. I think it's part of the reason I was able to sustain it for all those years. Now, when I went to the bullpen, that's a different thing. That people go, oh, well, see, he came back from Tommy John, he was throwing 98, 99. No, that's because the bullpen allowed 1 inning of that velocity to exist. I could not have done that at 5 innings or 6 or 7.
Let's end on one last thing, and I think we've touched on it a little bit, is off-season care. I mean, I know these kids having a chance to play maybe some other sports, rest, or just general off-season strengthening or conditioning.
I think no matter what season you end, you need at least 30 days of relief from that season, in my opinion. And then you can start picking up some playing catch. Let's just say all you play is baseball, which I think is a mistake, but let's just say that's it. Your body's got to rest. Cardio, you could probably still do cardio. It's a very important thing, cardiovascular. But playing catch, anything that's not to extension of grunting. Like I hear long toss, I'm not a big long toss in-season guy. I'm an off-season long toss.
Yeah.
Changing the release point too much in long toss in-season to where the stresses are going down. I'm not saying it's bad. I just think you flirt with losing your release point. So long toss is a good thing, but knowing how to long toss, knowing how to crow hop, knowing how to get it on a line without grunting and just getting to a point of stressing your body. I did personally. For me, I don't say it's for everybody. I threw a football in the off season, easy on my elbow, easy on my shoulder, and took the stresses off of gripping something like this, where you can see when you grip it what happens to that. And so those kind of things, there are many ways to do things to create less stress, but make things happen in movement so you're not stagnant. Go from like playing baseball 5 months off, then trying to pick up and throw a baseball is probably not proper either.
So definitely I would almost double what you said, 30 days. James Andrews, who you touched on, and even the pitch smart guidelines set by the Major League Baseball program says like 2 to 3 months of continuous off-season non-throwing. A throwing program, like maybe a long toss is okay. A strength program is great, looking at some flexibility work, things like that. One of the biggest recommendations that I would say is after that time off, make sure there's a ramp-up time before the next season, whether it starts in the spring or whatever, because that's where the highest amount of injuries occur is early on. So for the pros, it's in spring training. For the younger athletes, it's the first few weeks. It's because you go from nothing to just in a high intense motion. Take 6 to 8 weeks to prepare the body back in a more controlled environment for those stressors.
And I know John was really disciplined on his ramp up. You were always, I remember you talking about how some of these other guys were just coming to spring training and they were a train wreck, where your ramp up was just, you were very disciplined, which, and again, I think that goes back to what makes these kids successful is just discipline and doing the right things.
Just remember, baseball at 162 games is a marathon. It's not really meant to be played any close to the youth baseball where you're playing 80, 90, 100 games. And I think that quantity versus quality is really important. And when you're playing more is not better when you're younger. It's hard enough to do as an adult to play 162 games with the rigors and the stresses. So survived it all those years based on all the things we talked about. There's no one cookie cutter perfect way. And it's just like there's not one way to throw a baseball. So with balance and opportunities of information, seek it out, get all the information you can. That's good, but don't buy into one way of doing things because I think that's bad.
Well, John, I know you've got a busy schedule. It's been a pleasure again spending time with you and shedding some awesome light on the sport and what can help young athletes just prepare and be better. So thanks for being here, and Keith, thanks for your input as well.
Thanks for having me.
Yep.
You got it.
See you next time.